Well, I promise you I didn't pay him to say it. But that is a great segue into my wrap-up, and I only have 50 slides, so don't worry, it won't be long. I will be succinct because it's been a great 2 days, and I know everyone who's stayed, again, you all deserve a medal, but you have things you want to do and places you want to go. I would say the first thing I want to say is that we exceeded this year by every metric how we did last year. We had more attendees, we had more exhibitors, more sponsors, so I think that says something for the health of the conference, and again, it's a tribute to all of you because none of that would happen if we didn't have interested participants, so we appreciate that very much. I also can't resist again asking you all to give a round of applause to my staff, the staff at the Center for Connected Health. I have the privilege of going to a lot of meetings. I speak all over the world about our work, and I can tell you objectively this is a very well-run conference, and I'm very, very proud to be associated with the team who puts this on. We're starting Monday to plan for next year, so take a breath over the weekend, but this is a year-long effort. Now, someone asked me upstairs, a reporter, about an hour ago, what did I learn? What's the headline from this year? And it's such a rich, rich experience over 2 days that it's hard to pull one or two things out. But it comes back to our themes. One theme, that it's becoming part of mainstream healthcare delivery. And you have the example of Robbie Pearl from Kaiser talking about their millions of virtual visits, that in a couple of years virtual will be more prominent than face-to-face in their system. You have the wonderful work that was talked about in 2 panels back by the guys from the virtual visit space. Greg's talk about how we're going to have to move in this direction with authority in the next months to years, all speaks to the fact that it's time to scale this activity, and it doesn't come a minute too soon for me, I'll tell you that. The second thing I would say is really what, and again, the Internet of Healthy Things is an interesting turn of phrase, but what really came to me over the 3 days, including Wednesday, was this idea that wearables are moving beyond something that just tracks something. And you're getting a read on your stress level, or you're getting a read on your emotional state, or you're able to predict when someone's going to have an epileptic seizure, or you're starting to get a different second dimension to this whole wearables thing, and that's pretty exciting to me. I'm thinking that maybe we'll have a bigger presence of that on next year's program, because it's this whole brain-computer interface and emotional sensing. All of it is really exciting, and it's going to be really necessary that we figure that out to move us to the next level. So again, I thank you all for your loyalty, support, for coming out. It's been a great couple of days. Have a very good ride or trip wherever you're going, and safe travels and a good weekend. Thank you very much.